I'm James Cashman. I'm one of the transplant surgeons affiliated with the Banner Solid Organ Transplant Program here in Phoenix, Arizona.
I'm Beverly Hansen. I'm a transplant social worker at Mayo Clinic Hospital. My primary focus is with the donors.
My name is Celeste Brawley. I'm a registered nurse with the University of Arizona Medical Center, and I am the Living Donor Coordinator. And my role is really to work with all people who are interested in donating an organ to a friend or loved one, or even to someone unknown.
The testing process usually starts with a phone call to our nurse coordinator, to our assistant, and she'll do a basic interview, all medical questions. If you've had a history of cancer, high blood pressure, diabetes, you kind of go through a medical history.
Testing process is done in increments or phases, with the first testing being a simple blood test and a urinalysis. So we're basically looking at you to determine, are you in good health? Do your kidneys function properly? And determine your blood type.
If you are a match at that point, then we bring you in for about a 3-day evaluation. At that time, you're going to be initially with a donor advocate, who basically the donor advocate is the person that is kind of your voice through the whole process. But they also want to make sure that you understand the informed consent, that you really know what you're getting into. And then you'll meet with myself, social worker. You'll meet with the nurse. You'll see a nephrologist, the kidney doctor. You will also see a urologist, who is our surgeon. You've got several tests. You have MRI, CAT scans, a lot of blood tests throughout the process. So it's going to be certainly the best physical you'll ever get as a donor coming through.
Different facilities have different requirements, but in some facilities they actually require you to see either a psychiatrist or a psychologist. But that's up to the individual center.
There's a number of things that we use for screening to make sure that we're protecting that person, because if there's a significant amount of risk to being a donor, we wouldn't want to put that person in that position. But also we want to make sure that the kidney that we're going to use for the recipient is going to be a good functioning organ.
There's an age limit for donors. Most facilities is ages like 18 to 70. Some facilities start at 21 and some close it at 65.
Typically we look more closely at the health status of the patient. So I've seen plenty of super healthy 60-year-olds and 45-year-olds that aren't fit and wouldn't be healthy enough for the procedure as far as being a living donor.
When our donors come through for evaluation, we let them know that the whole team that is seeing them for the evaluation, none of us have met the recipient. Our whole focus is that donor.
Everything that we do for that donor is kept confidential, down to withdrawing, down to proceeding questions. All those things are protected. The purpose of our program is to protect that donor.
My relationship with the donor is exactly that. It's I'm the donor advocate, and certainly in the surgical arena and any of the workup, as well as the surgery and the care afterwards.
Every patient that comes in, every person that they see, so the doctors, the social worker, the donor advocate, we really let that patient know that they can opt out of donation at any time in the process. They don't need a reason. It doesn't matter what their reason is. We tell them that we don't want them feeling any pressure just because they're starting the process to have to complete it, and we encourage them at any point that if this is not for them, then we just stop the process right then and there.
Know your coordinator and feel free to talk to that transplant coordinator. Everything you say to me, everything you say to your transplant coordinator, confidential. You can call us at any time, say, I don't want to do this, I'm afraid, I'm concerned, I've cried with my patients over the phone as healthy donors. Develop that relationship with that transplant coordinator. His or her job truly is your health and welfare.
There are other options if you're not compatible. We'll talk to you about paired donation. So if you're still healthy enough to donate, but you can't donate to that individual person, there's a paired donation where you could donate to someone else whose their donor is not a match to them, and then their donor would possibly be a match to your recipient. And so it's a great thing. Or we can do even a chain where one donates to someone, someone else donates, and it comes all the way around. And so you've got a lot of people getting their transplants from live donors.
The insurance of the recipient covers both the evaluation process, the surgery, and in-hospital stay. Also, the follow-up that's done at the transplant center post-donation is covered by the recipient's insurance.
We do not contact the donor's insurance at any time. In fact, we don't, as the facility, the hospital, we do not ever even know the donor's insurance.
Time off for employees from your work is something that I've never had trouble helping a patient obtain. Generally, employers are very enthusiastic, they're very supportive, but each donor knows their workplace and their boss better than anyone else.
Some companies will donate paid time off. We do, however, have agencies in the country that help with time off and that missed income. So they can apply for assistance for that missed income if they're not going to get paid during that either the evaluation or the surgery. We have organizations that we can ask for assistance for the travel and lodging as well.
Travel expenses is something for the donor, especially if they're traveling from out of state or another city, that are not covered under the recipient's health care insurance as a general rule. Although some insurance companies do pay for and give travel reimbursement.
Well, if there's complications from the surgery, the facility, the hospital will take care of that. And there's no cost. If it's directly related to the surgery, there's no cost to the donor.
Those instances, thankfully, are very unusual, very rare. And when it does arise, usually it could be a small hernia or some sort of defect at one of our laparoscopic sites. But I think because it's that donor is so well tested and has gone through a lot of evaluation processes that it's very unusual for us to have an issue like that.
Transplant dates are an agreed upon date by both the donor, the recipient, and the transplant center. So basically it's an availability issue. That's really one of the greatest benefits of living donation is there's no 3 a.m. calls. It's a pre-planned scenario.
So for surgery for donors, what I tell them is they come in the morning of surgery. They come in with their recipient. It's a laparoscopic procedure. They pretty much have 3 laparoscopic incisions plus 1 longer incision where they actually pull out the kidney. The donor has their own surgeon and the recipient has a different surgeon. Both the recipients being prepped at the same time that the donor's having their surgery.
The surgical procedure is approximately 2 hours in length. Typically the patient will go back with myself and the anesthesiologist, get the patient asleep and prepared for the operation. We typically will start out with a very small incision close to the belly button where we'll put in a TV camera and take a look inside the abdomen just to make sure that everything looks normal and healthy and that the CT scan that was performed during the evaluation was correct. After that, then we'll place 2 small other TV camera ports that we'll use for that procedure. And so that takes about 15 to 20 minutes. The procedure itself is about an hour and a half of mobilizing or moving the tissues around the kidney away to where we can get to it. Once we have a good visualization of the kidney itself, we'll go ahead and disconnect the artery, the vein, and the ureter from that kidney. At that time, the kidney is removed from the abdomen through the incision close to the belly button and then taken where it's flushed and prepared for the recipient surgeon. In the donor operation, I'm there with the donor the entire time, so I'm able to look after the kidney's removed to make sure that there's no issues with regards to bleeding or anything else, and we close up the access port, the 3 access ports, and wake the patient up.
It's interesting. What I tell most of our donors on what to expect after the surgery, I would say probably 80 to 90% of our donors actually feel worse the day after surgery. I think really professionally, what I have seen is I think the recipient is almost on a high. You know, there's a lot of euphoria. They're excited. And that kidney, most of the time with live donation, works immediately. On that table, it pinks up. And so I think they do feel better. Of course, the donor comes in feeling great and literally gets sucker punched. And so they don't feel very good that next day.
The donor wakes up groggy and sore in these sites, but not like the older days where it was a large incision and those patients really had a hard time with that open procedure. But you are sore in those 3 areas for a number of days, and just like any procedure, it's going to take a few days for that to go away.
Pain is controlled as we would with any other surgery, either by IV medication initially, post-donation, and then on oral medication once you go home.
The length of stay of the donor is typically 2 nights. So the day of the procedure and then the 2 nights afterwards is pretty much average. There are some people that'll maybe be in for an extra day, but I would say 2 nights is typical.
It's probably a good idea to take some of the pain meds for the first few days after surgery. And after that, nothing. You know, if you choose to take Tylenol, you can take that.
A return to normal lifestyle is really related to the surgical incision and surgical pain. So we tend to tell the donor to restrict their activity to light activity, no lifting, greater than 10 pounds for 4 weeks. After about 4 weeks, the activity is whatever it is you want.
Normally, the recuperation for our donors is about 3 to 4 weeks. Some donors take longer. Some may feel more tired. They might start to feel good, just still feel tired. And so some donors are 5 to 6 weeks. Our donors that, let's say they have their job is heavy construction, anything to do with picking up a lot of things, we'll say at least 6 weeks.
There are no staples or suture to remove, so they're just thin lines that tend to heal quickly. So the surgical scarring is very minimal, and healing process is quick.
Actually, for donors, there really is no lifestyle changes. We have dads who are, rough and rugged, playing football with their kids, and that's fine. I guess we've turned down a bull rider before, but other than that, we've had policemen come through, firemen.
Following of the donor after the surgery is relatively intense in the first few weeks. So, you're seen frequently and daily while you're in the hospital, and then we tend to have the donor return to see us in the clinic once or twice in those first 2 weeks. Typically after that, there's a process where we watch and evaluate the donor, regardless of their location, just to make sure that their kidney function afterwards is functioning normally, usually coordinated through the transplant program.
As far as studies that have been done over long-term donors over the years, the studies that I have read say that the average life expectancy for a donor is actually longer than the average life expectancy of just the general population.
Donors who have a successful outcomes with donating a kidney to a friend or loved one get the benefit of seeing it's almost instant gratification. The recipient is usually on some type of dialysis or support, tired, all those type of things. Once that kidney's donated, it's almost as if they get to see their friend or their loved one. They get their life back.
Success with regards to living kidney transplant is about as good as we can get. You're talking about the high 90 percentile because it's from a healthy person. It's an elective situation where no one's scrambling around at night or organs aren't being transported.
Most donors will tell you this has been probably the best thing that's ever happened to them, that it's a high point in their life. A lot of donors say that they fulfilled something on their bucket list.
To know that you have made a difference in someone else's life in such a profound way, to me it chokes me up just being their nurse. I can't tell you how exciting it is to watch families and recipients and all those people come together. Is it difficult? Yes. Is the surgery easy? Maybe not. But the outcome, the glorious change in people from the outcome, generally my patients tell me it's been worth it.